Okay, so we're in Ramsey, Rainbow Surgery. This is Jenny and this is Roy, and they're going to have a go at using Diego for the first time and tell me what they think of it.
It looks very clear, simple. It's pretty easy, quite obvious what each section's about.
What would attract you to go into first?
Community news, let's see what's going on.
What would you like to see in community news?
What's going on in the locality.
Such as... So which village are you in here? Where do you...
Well, we're in Ramsey. I don't actually live in this village, so really I suppose it's more about what's going on that's of interest to maybe the surgery and the patients.
Would it make life easier if you had buttons as big as that, or if they could talk or feedback?
For me this is great, but I could see the benefit of if it could talk to some people. Wouldn't work for me at work. I can imagine for home use that would be good.
Strangely enough, is the colour.
What do you think of the colours?
I don't like them.
That's good. Why? Let's give some
I
feedback
just
on
think
that.
the colour, I think the background is wrong for me. The background colour is wrong.
How would you think it could be improved?
By going for something like a very light green.
Would that make it easier on the eyes?
It would make it easy to look at. So I'd have something almost like an ordinal, which is a very, very pale green. Or even a pale blue on there would be better than...
Do you mean behind the button?
Behind, I'm talking about the background.
Rather than the white.
Yeah, I'm talking about the background.
Soften it up a bit.
Yeah, I don't think the background's right.
Okay.
And I'm pretty sure that quite a few people would find that.
Do you think patients would find it easier with a paler background?
Yes, definitely.
What about if it could have voice recognition and things? How would that help any of your patients?
I'm not sure about that.
Anybody
for some it would, and for others it wouldn't.
Maybe those with learning disabilities, where it's not a sight issue, it's an understanding issue. That might help if somebody's actually talking to them.
Yeah, it would help then.
But also, you've got the boxes which obviously got writing in, but it's pointless it being there because it's so small.
Right. So then.
And I've got good eyesight.
Yeah, I've not got bad eyesight.
To me, that either needs to be clearer or not there.
Right.
It would be very helpful.
So do you think that somebody that's had a stroke would find this useful if it could speak?
Yes, I'd put it that way, yeah.
What sort of problems do people with strokes have when they're kind of dealing with computers like that though? So how would that help them?
It help them. It could help them to understand, because as with my limited knowledge, and I deal with a gentleman who has had a stroke, and he has good days and bad days. And on his bad days, his brain, he'll tell you that his brain registers it, but his mouth can't say what he's thinking. He can speak perfectly legible, but he can't relate from his brain what his brain wants him to say. So I know it sounds strange, but it is a fact.
So that would help him?
And I think being able to listen to it would help him.
Yeah.
Yeah.